Hello, my name is Dr. Aditya Kapoor. I am the Director for Orthopedics at Omega Hospital, Gachibowli. I specialize in shoulder, hip and knee surgery. Today we are going to talk about common causes of shoulder pain. Everything is not frozen shoulder. So what are the common causes for shoulder pain? One of the commonest causes for shoulder pain is actually following a strain. Sometimes people tend to do a lot of repetitive motion activities. This tends to cause inflammation of the tendons and the tissues. This results in what is called as tendinitis. This can commonly affect either the supraspinatus muscle or it can affect what is called as the biceps tendon. These are two important structures that we use. The biceps tendon helps in moving your arm up and down. Similarly, the supraspinatus tendon helps in lifting your shoulder. So commonly when you go to the gym or when you do activities which involve repetitive motions, this can result in inflammation. This is not a tear. Additionally, one of the other common causes of shoulder pain that seems to occur very commonly is what is called as calcific tendinitis. Calcific tendinitis happens when there is a repeated strain to the supraspinatus tendon, and commonly what happens is when there is a replacement of the normal tendon tissue with a fibrofatty tissue. This also causes a lot of pain because there is a small amount of liquid that is present in it. The other common cause of shoulder pain is what is called as bursitis. There are numerous fluid-filled areas around the shoulder. If there is inflammation of these, then one tends to get what is called as bursitis, the most common one of which happens to be resulting in pain, especially when you move the shoulder inside. That is commonly called as subacromial bursitis. Now, what are the other common causes of shoulder pain? People who tend to have a fall can result in either a dislocation where the shoulder comes out of the joint, or you can have pain when there is a damage or a tear to the muscles that stabilize the shoulder, called as a rotator cuff. So when you have the shoulder coming out of the joint, or in people who are overhead athletes, then you can have a tear of the lining of the shoulder. This could simply result in pain, which could be because of tear of the upper part of the lining, called as a superior labral lesion, or what is commonly called as a Bankhart's lesion. The other problem that may occur because of repeated either fragility of the muscles, or as we age, the muscles becoming a little bit weaker because of lifting heavy loads as well, could be what is commonly called as a rotator cuff tear. This happens if the muscles that stabilize the shoulder, like the supraspinatus, the infraspinatus or the subscapularis, these tear, and this can cause pain as well as typically you have difficulty in lifting the shoulder. One of the commonest causes for shoulder pain, especially amongst diabetics or after a trivial injury, can be what is called as commonly frozen shoulder and what is called as scientifically called as a adhesive capsulitis. In this, there is a reactive tissue that forms inside the shoulder, and what happens is shoulder movement tends to decrease, and this is typically what a frozen shoulder is.